From the broadcast center in Los Angeles, this is KCAL9 News at 8 a.m.
The dangers of stroke were never more clear than this week with the death of actor Luke Perry. What you can do to protect yourself, we'll find out coming up next. Actor Luke Perry passed away from a stroke this week. He was only 52 years old. His death made many wonder, can it happen to me? Joining us now to talk about how you can protect yourself from a stroke is neuroradiologist Dr. Suzie Bash from RadNet. Good morning, doctor. Thank you so much for being here.
Thank you for having me.
Appreciate it. So, first of all, can someone have a stroke just kind of out of the blue with no warning signs leading up to it?
Unfortunately, absolutely. Anyone can have a stroke at any time and at any age.
Okay, so just to clarify for some folks who may not know, what exactly is a stroke?
So a stroke is brain cell death due to lack of blood flow.
Okay.
And there's two different kinds of strokes. You can have an ischemic stroke, which would be lack of blood flow due to a blood clot, or a hemorrhagic stroke, which is a rupture or leakage of a blood vessel. So it's a brain bleed.
Okay. And what are some of the risk factors? Because many people are saying, you know, age is usually a factor, but he was only 52 years old. Is it typically one of the risk factors?
Age is a risk factor. Your incidence of stroke doubles every 10 years after the age of 65.
Okay.
But 1/3 of strokes actually occur in people under the age of 65. So age is a non-modifiable risk factor, but there are a lot of risk factors that you can actually do something about that are modifiable. Blood pressure is one of the most important ones. Hypertension is an increase of a 5-fold increase in stroke risk. Another one is atrial fibrillation. That's an irregular heartbeat that can...
AFib is what they call it.
AFib,
right.
exactly.
Okay.
That's a 5-fold increase in stroke as well. Something that can be treated. Other things would be high blood pressure. We already talked about that, sorry. High cholesterol or diabetes to make sure your glucose levels are maintained. And then there's a lot of lifestyle factors like obesity, lack of exercise, smoking. Smoking's a 2-fold increase in stroke. Diet, avoiding things like amphetamines or cocaine, and excessive drinking. Those are all things that we can modify in our lifestyle to decrease our risk of stroke. And actually 80% of strokes are preventable. A lot of people don't realize that. So there's a lot we can do to help try to prevent.
And there's been a lot of great strides in treatment of stroke. Isn't that right? Can you tell us about that?
Sure, yes. Probably the mainstay of treatment would be TPA, that stands for tissue plasminogen activator, and that's the clot busting drug.
Okay.
Not everybody is a candidate for that. You have to get imaging first. So when you call 911 if you have a stroke, the paramedics will bring you in. You actually bypass the ER. You go straight to imaging. We have to make sure that it's not a hemorrhagic stroke because you can't give a clot-busting drug if it's a brain bleed.
Okay.
But if it's not, then you might be a candidate for TPA, which will help break it up. And there's also something that they have, it's called mechanical thrombectomy, where they can actually deploy a stent over the clot through your artery and pull the clot right out. And that you actually have a 70% improved outcome if you're a candidate for that procedure. So after the imaging, either CT or MRI, but it's typically CT, we then know where that blood clot is, and then you'll move on to get the TPA if you're a candidate, or the thrombectomy, or both, ideally.
Okay. Now, if it seems that a loved one is showing signs of a stroke, symptoms of a stroke, what should you do, and how can you really identify that it is a stroke?
That's an excellent question. So typically stroke signs happen suddenly, and they often happen on one side of the body.
Okay.
And a good mnemonic to remember is B FAST. The B stands for sudden onset balance difficulties. The E is for eye, sudden onset visual problems.
Okay.
Okay, and then the F is for face, facial asymmetries. The A is for arm drooping or weakness. The S is for speech, any disruption in your speech pattern. And the T is a reminder for time, how critical time is. When you have a lack of blood flow, every minute that you have no blood flow, we actually lose 1.9 million brain cells. Wow. So time is brain. That time to calling 911 is absolutely critical.
Wow, great advice, doctor. Thank you so much for being here, and good insight and good advice for our viewers. Thank you. And if you want to watch this interview again, or you want more information on stroke prevention, just go to our website, KCAL9.com, and click on Seen on TV.